So the next video is on staging of the carcinoma penis. Management of carcinoma penis is done both by urologists and also surgical oncologists, and the staging is the most important part. So today we'll discuss the AJCC 8th edition staging of carcinoma penis. So starting with T staging, it is divided into T1, T2, T3 and T4. Starting with T1, so before going into the T staging, we need to understand the anatomy of the penis. Suppose this is shaft of the penis. So coming from outside to inside, outside there is an epithelial layer, lamina propria, a superficial fascia, which is continuation of the collis fascia of the abdomen. In penis, it is called the dartus fascia, and a deep fascia called the buccal fascia. So the outermost is the skin layer, which has an epithelium and a lamina propria, followed by superficial fascia and the deep fascia. And covering the bodies of the cavernous muscles is the tunica albuginea. So these two bodies on the upper part are the corpora cavernosa and a corpus spongiosum through which urethra passes. So with this basic anatomy in mind, we'll see the T staging now. In T1, based on the involvement of the glands, foreskin, or the shaft. In T1, the corpus muscles are not involved. So the corpus cavernosa and corpus spongiosum are totally free. In T2 and T3, 3 is for alphabet C. So I remember like this. This is involvement of corpus cavernosum and T2 is involvement of corpus spongiosum. And this can be with or without the involvement of the urethra. Applies both to T2 and T3. In T4, it is involvement of adjacent structure just like any other T staging, which is scrotum, pubic bone, or prostate. In T1, again, it can be either T1A or T1B. T1A is low-grade tumors, grade 1 and grade 2. T1B is grade 3 tumors, that is high grade, also includes sarcomatoid variant. So basically, in T1, it is involvement of glands, foreskin, or shaft without the involvement of corpus spongiosum or corpus cavernosum. So it is usually limited to the superficial fascia, skin. Coming to end staging, it can be either clinical N or a pathological N. N is divided into N1, N2, and N3. N1 is presence of ipsilateral single inguinal lymph node. N2 is presence of either multiple unilateral or bilateral nodes. N3 is a fixed inguinal node or the presence of pelvic nodes. Pathological end staging is slightly different from the clinical end staging in that the number of inguinal lymph nodes differ from clinical and pathological. In pathological N1, presence of 2 less than or equal to 2 inguinal lymph nodes is N1. Here it is 3 or more is N2. N3 is presence of extranodal extension or the presence of pelvic lymph nodes. This is the staging of carcinoma penis.